Hello, everyone. I'm Dr. Teena Chopra. I'm a professor of infectious diseases and epidemiologist and assistant dean for faculty development at Wayne State University. Today, you're going to spend the next 40 minutes with one of the greatest minds in medicine. He's the face of public health and public policy in the world. A distinguished professor at Georgetown University, he also holds an additional appointment at the university's McCourt School of Public Policy. Previously, he served as a director of National Institute of Allergy and Infectious Diseases at the NIH from 1984 to 2022. He was a key advisor to 7 presidents and also served as a chief medical advisor to President Joe Biden. He has received numerous awards, including the Presidential Medal of Freedom, the National Medal of Science, and the Mary Woodard Lasker Award for Public Service. He's been awarded 62 honorary doctoral degrees from universities in the US and throughout the world. He has authored more than 1,400 scientific publications. Some fun facts about our speaker today. He was also the captain of his basketball team. He's also a great speller. He participated in the citywide spelling bee when he was in school. Above all, he's an incredibly kind, modest, and giving person. In his own words, the core of public service is doing something that's beyond your own self, beyond your own potentially selfish motivations. Ladies and gentlemen, please welcome Dr. Anthony S. Fauci. Hi, Dr. Fauci, how are you?
Thank you, Teena. It's a real pleasure to be with you. Thank you so much for having me. I'm looking forward to our discussion.
Thank you, Dr. Fauci. I welcome you today on behalf of the Wayne State family, our leadership, our faculty, students, and staff. We have more than 400 people joining in today. And, before I start asking you questions, the one big theme today, the big from everybody was make sure you thank Dr. Fauci for his service during the pandemic and beyond. Some of them didn't have questions for you, but they just wanted to thank you.
Thank you. I appreciate that. Thank you so much.
Dr. Fauci, we'll begin. We all know that we've had more than 1.1 million deaths in America, and we are still counting. We clearly fell short in our public health response. As you know, we are located in Detroit. Wayne State University is the only university, one of the largest in Detroit. What do you think is the role of academia in public health? As you know, we are moving towards establishing centers for emerging infectious diseases, schools of public health. What kind of teaching should we include so that our younger generations can better understand public health? I know that you are assuming a teaching role at Georgetown. How do you plan to include public health in various curricula?
Well, that's a really great question, Teena, and I think I can answer it best by explaining how I look at the pandemic preparedness and response into 2 fundamental buckets. One is the fundamental science, basic and clinical science bucket, and the other is in the public health bucket. Academia, where you have scientists who are doing work in fundamental, basic, and translational research, was the single success story of the epidemic. And by that, I mean that the support, mostly but not exclusively by the NIH, of scientists over the previous 15 to 20 years in the arena of the development of platform technology, including mRNA, which was such a successful vaccine platform, the many years of work that was done on structure-based immunogen design to develop the optimal stabilized immunogen of the spike protein, which was so successful, and then the investment, particularly in operations like Operation Warp Speed, to do something that has never before even imagined to be done, is to go from the availability of a genomic sequence of a virus on January 10th to develop a phase 1 trial in 65 days, a phase 3 trial in 125 days, and to have a vaccine that has been proven in a clinical trial involving tens of thousands of people to be safe, effective, and going into the arms of individuals in 11 months, the end of November, the beginning of December. That was a combination of the synergy between academia and pharmaceutical companies. That is unprecedented. That is beyond any precedent to do it. So that's one role of academia. But then you ask another question is, what about the public health role of academia? And I think that even though most people don't fully appreciate the importance of the role of academia and public health, it's for the academic people in infectious diseases like yourself and your team in Detroit, teams in other cities like New York and San Francisco and LA and all the cities that got hit, and even in some of the community places, is to analyze the data of what we did right and what we did wrong. And the best way to do that is to go to the people who are in the trenches. And I think the city of Detroit, in many respects, was the Midwest epidemic epicenter of the trenches. So what you learned about what should be done, what is needed, what you didn't have and needed, so that when you prepare for the next pandemic, you can say, these are the things we had that worked well. These are the things we had that didn't work well. And these are the things we didn't have that we should have had. So all of that has to spring from the bottom up. It can't be from the White House or the CDC or the NIH down. It's got to be from the bottom up. So the short answer to your question is that academia clearly has played a successful role in the science and the development of interventions like vaccines and therapeutics. But they also have a very underappreciated role in getting the data and the correct science associated with public health. So bottom line, it's an important role.
Thank you, Dr. Fauci. This was a very nice summary, of academia and public health. And I'm sure our medical students are listening to this as well, and how they can be involved in public health, not only during pandemics, but also otherwise. You rightly pointed out about Detroit being the epicenter. We have major health disparities in Detroit. The social vulnerability index is one of the highest in the nation. And the pandemic only made it worse. As scientists, we were communicating information which was changing so rapidly. So how do you establish trust with your community in such a dynamic situation?
Well, let's look at the problem first, and then we could see how we're going to connect with the community. One of the things that has become very clear in most outbreaks, including HIV, is the inequities in health access are very important determinants of the negative impact of an outbreak. And this was dramatically emphasized and apparent with COVID. Detroit, as you mentioned correctly, Teena, has a great deal of health disparity, particularly in brown and Black people, which occurs not only to the lack of access to health, but the decades, if not centuries old social determinants of health, which make it more likely for an individual of a minority population to, if they do and when they do get infected, to have a more serious outcome. And what we're learning is that that's not genetically, racially determined. It's determined by the social determinants of health. The fact that because of lack of access to health care, because of economic considerations and lack of accessibility of a good diet, for lack of a number of things, that throughout the country, but particularly emphasized in cities like Detroit, New York, and right here in my own city of Washington, D.C., that take African Americans, for example, they have a much higher degree of obesity, diabetes, hypertension, chronic renal disease, chronic obstructive pulmonary disease. those are those issues when you look at the likelihood of progressing to severe COVID when you get infected. Now, we're not going to change those social determinants overnight because it took decades and centuries based predominantly on racism and discrimination. But we have to make a commitment now that we have 1.14 million deaths in our country, the worst outbreak since 1918 pandemic flu. And I would hope that the corporate memory of the fact that social determinants of health played a role in that, that we need to have a decades-long commitment to do something about that. But let's talk about what we can do tomorrow. And I think that if you want to prepare for the next pandemic, you've got to look for the accessibility and the access to health in the form of testing, to have clinics that are available to people as opposed to just tertiary hospitals. You've got to get out into the community. So if there's anything that we learned in COVID is that it's at the community level. The disparity is at the community level. Once you get a person who suffers from health disparity into a tertiary hospital, once you get into one of your hospitals, well, then everybody's equal there. It's what happens before you get into the hospital. And that's the thing we have to pay attention to in the next way we prepare for a pandemic.
Absolutely. You said it very rightly, about going out in the community. Initially in the beginning, obviously, nobody expected that this is going to happen. But it took us a while. It took us a few months to get ready and go out to nursing homes, go out to people and offer support in the form of testing. Testing was obviously one of the biggest limiting factors here in Detroit. But it took us a while because we never expected, in your own words, expect the unexpected. And that is where we want to be next time. But, this is a nice segue into talking for a few minutes about public health response in nursing homes across the nation. I feel like we really failed our elderly at so many levels. When we were in the midst of the surge, like I was talking to you backstage, our elderly patients coming to the ERs from nursing homes, their mortality was as high as 80%. We didn't even test them and they were gone, very, very unfortunate. And of course, COVID-19, it's not like COVID-19 did this. I think it's COVID-19 exposed the inadequacies of the nursing homes. So what we learned here in Detroit was that not all nursing homes were equal. There are some good ones, but they are only available to the wealthy and to the insured. So for example, today, if we have a nursing home patient and they develop fever, what will happen to them? They'll be sent to the ER. And this patient, who's already partly dementic, will be exposed to more trauma, to more infections. So my real question to you is, do you think that in the future, our nursing homes are better prepared administratively, financially, and legislatively for any kind of public health crisis?
Well, right now, the answer is no. So we have a task in front of us. I think, Teena, you just described it better than I possibly could have described the problems. The question is, what about the solutions? I think what happened in nursing homes, some of which are unavoidable just on the basis of what a nursing home is and what the structure of a nursing home is. And the other are things that we've got to learn to have done administratively and otherwise. I mean, for example, when you have an outbreak that's as highly contagious as SARS-CoV-2 is, the idea of the staff being the individuals who are spreading it among the occupants of the nursing home was something that we didn't fully appreciate, thinking that it was one nursing home inhabitant spreading it to another nursing home inhabitant. We were not I'm not saying this happened in Detroit, but broadly at 40,000 feet in general, we need to pay more attention to, do we let visitors into a nursing home to an outbreak? And if so, we can't say that you're going to get these old people and shut them off completely from the people who love them, but you've got to be very careful in who comes in. Are they vaccinated? Do they have a good N95 or KN95 masks? Do they stay away if they're asymptomatic? Do they test themselves before they come into the nursing home? Those are things that are lessons learned within the nursing home. So we've got to do better. I think, I had a lot of contact with Seema Verma, who was the head of CMS during the Trump administration. And she was really very good. And she understood those problems right from the beginning and did everything she could to try and alleviate them. But I think there's still a lot of work to be done. And you pointed out yourself some of the really important issues. I mean, I myself had a personal experience because my wife's mother was in a nursing home who was, demented, not totally, but partially demented. And the same thing happened. She had a fever, and a typical 90-plus-year-old person who's a fever in a woman, you think urinary tract infection right away. You bring it to the emergency room. It was a terrible experience. I mean, she was there for hours and hours with us before we could do anything. And then they treated her and then bring her back. Thank goodness she didn't have COVID. But if she did, it really would have been a real difficult situation. So there's a lot of work that needs to be done at the level of nursing homes.
Yeah, involving the nursing home staffs in public health, educating them about public health. Like our team from Wayne State went into nursing homes. We dropped what we were doing because it was like there was a hole in the bucket that we needed to patch. We were doing patchwork. So we went to nursing homes, physically went there, myself included, and started swabbing everybody and then cohorting patients. And there was no room to cohort them. And so we created a nursing home where we put all our patients who were negative in one nursing home, because the other thing is the logistical challenges. They are not equipped with private rooms. They are not equipped. So there are so many other challenges, which I think even at this point, if we have a disease X, we are not prepared.
No, I totally agree. I mean, it's remarkable that you were able to cohort in individual nursing homes and do that. I mean, that must have been a logistical challenge, the likes of which that very few people could handle. That would be a really logistic challenge to do that.
Absolutely, but we have a very, very good team. Which you very rightly point out in your article that you've written, that we had to channel all the resources that we could, whether it was making our own hand sanitizer, whether it was making mobile unit clinics and going into to people and giving them vaccines and doing testing and whatnot. But Dr. Fauci, the other big worry as an epidemiologist practicing in Detroit that I have is our low vaccination rates in Detroit. Our childhood vaccination rates have fallen below 40% in Detroit. And I'm not just talking about our COVID booster rates, which are low, but tomorrow, if we have a measles outbreak or even a polio outbreak, I wouldn't be surprised. What can we do to increase our vaccination rates? That's one. So I want to share a little story with you. I like I was mentioning to you, I did my med school in India, and I was on the front lines with the polio vaccination campaign. They made us rotate in rural India during the vaccination campaign. So I would go door to door with my colleagues and talk to families, knock at their door, have a cup of tea with them, and give their kids 2 drops of polio vaccine. It was very easy. It was fun. It was easy. There was no resistance. But now, coming to COVID and to other vaccines, there is so much misinformation and disinformation on social media. The question is, how do we overcome this hesitancy?
Yeah, Teena, you're bringing up a problem that is one of the most difficult problems that we are facing and that we will face in the future. There has always been a small element in the country of anti-vax and anti-science. And with the political divisiveness in which public health has taken a political intonation to it, where, I mean, we know that if you look demographically at the country, it is less likely for a red state to get vaccinated against COVID than it is for a blue state. And deaths among COVID are more in red states than they are in blue states. That is terribly tragic that a political ideology is going to be responsible for whether or not you are healthy or not, sick or not, or dead or not. So the only thing that we could hopefully do is to try and separate those ideological considerations from public health and get people to realize that historically, vaccines speak for themselves. The only trouble is that in the disinformation and misinformation associated with the social media, it becomes very difficult, if not impossible, for people to look at facts, evaluate them, and say, take a look at the curve. The people who were vaccinated, their hospitalization and mortality is like this. The people who are unvaccinated, it's like that. Those data come out and hit you like a Mack truck. Yet there's still people who feel beyond public health rationality that they just don't want to get vaccinated. Now, that's bad enough for COVID. But the thing that you're referring to that worries me as much outside of the realm of COVID is what that means for normal childhood vaccinations. Are mothers and fathers really going to not have their children get measles, mumps, rubella, hepatitis, Haemophilus, and all that? That would be a terrible tragedy in the United States, because if you look at facts, not tweets, not social media, but facts, is that every time you get a level of vaccine in a community below a certain level, particularly with measles, because measles is always the canary in the coal mine because it's such a highly transmissible virus. Whenever you get below a certain level of the community into the 80s or lower, then you get the measles outbreak. We see it in pockets. We saw it in Disneyland. We saw it in upstate New York, in Rockland County, where you had a certain religious sect didn't want to get vaccinated. And as soon as someone came in from the outside into the community, you had a massive measles outbreak. I just think we have to keep pushing with correct information. You know, there's this freedom of speech in this country that, if taken to its extreme, can really lead to a problem. And that is, you can't suppress somebody from spreading misinformation, but you can counter it by aggressively spreading correct information. And that's the thing. It's all of our responsibility. I try to do it as much as I possibly can. I know you do it a lot, but everybody's got to do it. Medical students have to do it. Interns, residents, fellows, everybody has to be very aggressive in articulating the correct information about vaccines.
Absolutely, very rightly said. I'm going to quote Dr. Jack Sobel here. I was having this discussion with him recently, and he said that American healthcare is focused on specialists and not primary care physicians. He believes that it's the primary care physician's responsibility to educate patients on immunizations. And he thinks that we need to empower them more. You know, if you look at America, if you look at the number of urgent care centers we have, you know, our healthcare is really building more urgent care centers, but are they empowering primary care physicians is the real question. And what are your thoughts on this?
No, I think that he's absolutely correct. that is the place where you can get education done right at the point that Jack was saying. And I think we got to pay much, much more attention to that. So he hit the nail right on the head. That's where you got to do it.
That's very reassuring to know, you know. I'm going to switch gears a little bit here and talk about lockdowns. You know, why do we have lockdowns? We have lockdowns because we want to buy time so we can harness resources, whether it is testing, ventilators, vaccines. But the fact that we needed such long lockdowns here in the US, you know, what does it say about our preparation for the next unprecedented pandemic? The question I have is, do we need to build more negative pressure rooms or beds or even hospitals? If we have another big pandemic, disease X, let's say, are we prepared to manage it without shutting down schools and businesses? And for you, are you aware of any state by state legislative or financial commitments that are directed towards these resources so that we don't have such long lockdowns?
Yeah. I think, Teena, that we have to separate the advisability of lockdowns and the duration of lockdowns versus the need for better facilities like negative. I think we do need more negative pressure beds and rooms, but I wouldn't overdo it because that's not the answer in itself. I think if we think, okay, you know what we'll do? Every city will get 2 or 3 new hospitals. First of all, financially, it'll never happen. You won't be able to do it. But I don't think that's the solution. But getting back to the important part of your first question, and I think you answered the question partially with your question, and you said that lockdowns have to have an end game. You have to have a reason to lock down. For example, in New York City, when Elmhurst Hospital was overrun and they were having cooler trucks outside because they had no places to put the bodies, you had to have something to immediately shut down the tsunami of infection. That lockdown was absolutely justified. The real critical question is, what do you do during the lockdown? And when do you stop locking down? So lockdown has a purpose. One of the purposes, if you don't have a vaccine, it's to get more ventilators, get the hospitals better prepared, get more people involved in the healthcare sector to do it until you decompress the pressure on the hospitals. Then you could open up. If you have a vaccine available, you might want to lock down temporarily so you can get everybody vaccinated. That was, I think, one of the problems in China. They locked down for a long time, but they didn't effectively vaccinate all of their older people. So when they opened up again, all of the elderly, not all, but many of the elderly people got infected. So lockdowns with a purpose work. It saves lives. You get into a problem if you prolong the lockdown and you don't do what you need to do to reopen. I've always said right from the beginning, even people who are, I think, of ill intent have said the opposite of me, is that I've said from the beginning, once you lock down, you have to start planning about how you're going to reopen. You don't lock down and say, see you around, come back, whenever. You say, I'm locking down. Now, how do I plan to reopen? Reopen the schools, reopen the places of business. And the way you do that is to have a plan about how you're going to protect. For example, in schools, we need better ventilation. Absolutely. One of the things we haven't paid attention to is ventilation. We've got to be able to get work schedules to be able to get people to stay at work, but work the schedule so that you don't have overcrowded in a place. Those are the kind of things we need to do. And it gets confused because some people think lockdowns are bad or lockdowns are good. No, lockdowns have a place, but they are not the permanent solution.
Very nicely said. I love the piece about more ventilation in schools. I have a 9.5-year-old, and it's not easy for them to be home, but having more ventilation in schools and having work schedules, I think, is a great lesson that you point out too. Let's talk a little bit about climate change, Dr. Fauci. We have seen that we are seeing the wildfires in Hawaii, and climate change is real. It's affecting all aspects of our lives on this planet. Do you think that zoonotic spillover is also indirectly aided by climate change? And if so, what measures are organizations like NIH and CDC taking to help tackle this problem?
Okay. So the answer to your first question, Teena, is an absolute yes. I mean, I was just reading this morning, not in preparation for this, but just my usual reading of the literature. There have been now clear indication that with the increase in warming, that the range of vectors, including mosquitoes and ticks, are leading to tick-borne diseases in areas of the country where you never had these tick-borne diseases. We're seeing malaria in the southeastern part of the United States. We're seeing dengue spilling over into Florida and Texas. We're seeing Zika doing that. So the zoonotic diseases, particularly those that are directly or indirectly involved with vectors like insect vectors, without a doubt, play a role. Climate change plays a role in that. So the answer to your question is an unequivocal yes. You're saying, what measures of organizations like NIH and CDC doing to tackle the problem? Nothing. And the reason is that it isn't the mandate of the CDC and the NIH to counter climate change. There are other organizations and commitment on the part of society. What the CDC and the NIH can do and actually does is to study those diseases and get better vaccines against dengue, against malaria, against Zika, against tick-borne diseases, so that when climate change does cause a greater spillover in zoonotic diseases, we'll have the tools. But the climate change countering has to come from an international commitment to decrease the carbon imprint in society, so you don't have the kinds of crazy weather that we're having in this country. I mean, if you look at it, I mean, everything from the fire, the tragic fire in Hawaii, to Texas, which had something like 75 days in a row, over 95. I mean, it's completely, really amazing what's happened with climate change.
Yeah, like you said, I was also reading this, that, the wildfires can actually seed the atmosphere with microbes, dangerous microbes. And that was something that I didn't know about before. So, I mean, this is a big problem. And I hope that our viewers who are listening, especially our younger generations, can be more knowledgeable and aware and learn more about it in their respective schools. But my next question, Dr. Fauci, I hope you don't mind, but this will surpass the pandemic. Do you have any regrets about any of the decisions you've made during your tenure in the NIH while helping with outbreaks and emerging infectious diseases?
The answer is absolutely. I mean, I can tell you that, well, certainly, first of all, nobody's perfect, and certainly not me. I'm not perfect. I look upon myself as a realistic but humble person that knows that you don't know everything. But the one thing that I can say that I have done is that I've acted with the knowledge I had at a given time to the best of my judgment. Now, the problem is, in our field of infectious diseases, Teena, that you know well, is we're often dealing with a moving target. So let's take COVID, for example. What we knew about the virus, its transmissibility, efficiency, aerosol, transmission by asymptomatic individuals, whether masks work or not outside of the hospital setting, we, over weeks and months, learned more and more and more. And I can say without a doubt, if I knew in January what I knew in July of 2020, there certainly are things I would have done differently. And masks is a typical example. Early on, we were not fully aware of the advantage of masks. So we weren't recommending masks in the beginning because we thought, well, the virus wasn't easily transmitted. There was a lot of talk about, well, it jumps from animals to human, but it's not very well transmitted from human to human. Then we find out a few weeks later, it's very well transmitted from human to human. Then we find out a week later that it's aerosol transmitted. Then we find out that 50 to 60% of the people are transmitting it who have no symptoms at all. And then we find out that even though we didn't think masks worked outside of the hospital setting, that a good N95 well-fitted mask actually does work. So when in January you're saying we don't necessarily need a mask, in April, May, June, July, it's everybody should be putting a mask on. So if I knew in January what I knew in July or April or May, I would have done things differently. So the answer to your question is, of course, you have to have regrets of things that you could have done, but it's not an excuse, but you didn't know about it at the time you made the decision. If I knew about it, I think we would have done a number of things differently.
Thank you, Dr. Fauci, for this. So I know that we are short on time, but I do have to ask this. We have a new variant, EG5.1, and today is August 15th, and we still don't have our monovalent booster vaccine. And then there is this pandemic is over culture that we all are aware of. Our immunity has been waning after the boosters, and hospitalizations are slightly up. There are no masks I see in the community, and when I wear one, when I'm at the airport or in the flight, I see people laughing at me. What are your thoughts on that? And any thoughts on what to expect in terms of the flu, RSV, COVID moving into the fall?
Well, first of all, you had about 7 questions there, but that's good. I'll try to succinctly answer. First of all, we are not done with COVID. We know that. I mean, if you look at just the last couple of weeks, that the number of cases last week are 12% greater than they were the week before and 25% greater than they were 2 weeks ago. We have an uptick in cases and in hospitalizations and in deaths. It isn't anywhere nearly as bad as it was a year and a half ago. So we're not saying we're in an explosive surge, but it's ticking up. And it's ticking up for the reasons you gave. 96.7% of the United States population has antibodies to show they either were vaccinated, boosted, infected, or all of the above. So we do have a degree of baseline cross-reactive immunity. Most of the viruses that are circulating, including the most recent one, and that's what, 17% of it now is the new variant. It's going to go up to 20, 25 and more. But right now, all of those, thank goodness, are derivatives of Omicron. So if you get the booster that is going to be done in September and October, which is the XBB 1.5, that is one that isn't, even though it isn't directly against the circulating one, there's enough cross protection that you should at least be protected against severe disease. So the bottom line is everybody's immunity wanes over time. We know that. Therefore, we should get boosted. And now here's the trick, Teena. We don't need to mandate anything. We need to recommend to people that if you want to be up to date on your protection, you should get a booster. And what the CDC and the FDA is recommending is that why not get it at the point in the fall where you can get it at the same general time that you get your influenza vaccine. However, if right now you're a highly vulnerable person and the chances of you getting infected, you may get a severe outcome, you shouldn't wait. You should get the booster right now. But for people who are otherwise healthy, the general feeling is to wait until the fall when you can get your flu shot. If you're an elderly person, you should also get an RSV shot. And if you're anybody, you should wind up getting a flu. So you should get 3 of them. I mean, somebody like myself, who, believe it or not, as much as you don't like to say it, is an elderly man, I should get the boost, I should get the flu shot, and I will get the RSV, and I will do that.
Very nicely summarized, Dr. Fauci. I do want to share with the faculty that Dr. Fauci has written an article in the Journal of Infectious Diseases that was published in April, Pandemic Preparedness and Response, Lessons from COVID-19. So I really urge you to read it. I will share it with you as well. I hope that this fireside chat has ignited hope and inspired you all. As Dr. Fauci alluded to, we can be part of public health no matter what role we play in our communities. With this, Dr. Fauci, any parting words? Of course, I should also tell others, other than being involved in public health and also maybe doing some spelling bees, you can be like Dr. Fauci. Any parting words, Dr. Fauci, for
Well,
us?
my parting words, Teena, is only really a big thank you. It's really great to be with you. I enjoyed very much our conversation. And as I mentioned, you folks in Detroit are really in the trenches, and the work you do is, as they say, it's God's work that you're doing there in Detroit. Just keep up your great work. You're doing a lot for the community, and any way that I can help you, don't hesitate to contact me. Thank you so much. Take care.
Thank you so much. Thank you for being here. We are honored.
My pleasure. Thank you.